Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Let's look at some dermatological conditions or disorders along with the few histopathological examination. So first is we look at the immunobullous disorders. Immunobullous disorders. So under this immunobullous disorders, first is the pemphigus vulgaris. So under this pemphigus vulgaris, there is multiple acantholytic cells. So multiple acantholytic cells. So they are nothing but the Sank cells. Next, we move on to the 4S. So SSSS. So SSSS stands for the staphylococcal scalded skin syndrome. So this has a dyskeratotic acantholytic cells. So dyskeratolytic cells, dyskeratolytic acantholytic cells, and it has a very few inflammatory cells plus few inflammatory cells. Next we move on to the TEN. The TEN stands for the toxic epidermal necrolysis. Toxic epidermal necrolysis. So this has the necrotizing and the degenerating basal cells. Necrotizing plus degenerating cells, basal cells. And it has a scattered inflammatory cells and fibroblast with scattered inflammatory cells, and also it has fibroblast. So we saw pemphigus vulgaris, it had multiple acantholytic cells, staphylococcal scalded syndrome, very few inflammatory cells. Then TEN, which had necrotizing and degenerating of the basal cells. Now moving on to the other disorders such as BP, Stevens-Johnson syndrome. BP stands for the bullous pemphigoid, Stevens-Johnson syndrome, as well as the erosive lichen planus. So all these, there are no acantholytic cells and many leukocytes are present. There are no acantholytic cells and there are many leukocytes which are present. Next, let's move on to the cutaneous infections. So under this cutaneous infection, we look at the herpes simplex, the varicella, as well as the herpes zoster. So in all these disorders, there can be the ballooning degenerations. So let's draw a balloon. So balloon degeneration. So there's a balloon degeneration as well as the multinucleated giant cells. Multinucleated giant cells. So balloon degeneration as well as the multinucleated giant cells, they are seen. Next we move on to MC. MC stands for the molluscum contagiosum. So molluscum contagiosum. So here there's a diagnostic intracytoplasmic molluscum bodies. So it is intracytoplasmic. So intracytoplasmic bodies. So they are nothing but the Henderson-Patterson bodies. Henderson-Patterson bodies. And the largest inclusion bodies, they are the largest inclusion bodies are about the largest inclusion bodies, and it varies up to 30 to 35 microns, around 35 microns. Next disorder is let's look at the vaccinia, ORF, or the Milker's nodules, and variola. So vaccinia, next the Milker's nodules, or the variola. So here the acantholytic squamous keratinocytes, the eosinophilic cytoplasmic inclusions called the guarneri bodies. So they are the acantholytic squamous keratinocytes, acantholytic squamous keratinocytes. So the guarneri bodies are nothing but the inclusion, the cytoplasmic inclusions. Cytoplasmic inclusions, they are nothing but the guarneri bodies. And then, as we mentioned, it is a acantholytic squamous keratinocytes are seen. Next, we move on to the leishmaniasis. So, under the leishmaniasis, there is the Leishmanian Donovan bodies, LD bodies, and they are grouped together in the swarm of bees fashion. So, they are known as swarm of bees. Swarm of bees fashion, and they are within the large macrophages. So they are within the large macrophages. So large macrophages, they are known as the right cells. Next, we look at the bullous impetigo. So under the bullous impetigo, they are dyskeratotic acantholytic cells. Dyskeratotic acantholytic cells. And they have abundant neutrophils and clusters of coccoid bacteria. So there are abundant neutrophils and cluster of coccoid bacteria. Cluster of coccoid bacteria. So abundant neutrophils and cluster of coccoid bacteria. Next, moving on to the genodermatosis. So genodermatosis. So under this, there are two diseases, Haley and the Darius disease. So let's understand what about the Haley disease. So this Haley disease, there are multiple acantholytic cells. So there is multiple acantholytic cells and direct immunofluorescence is negative. So there is the direct immunofluorescence. This is negative. So this is about the Haley disease, multiple acantholytic cells, and the direct immunofluorescence in case of Haley is negative. Next, we move on to the Darius disease. So under this Darius disease, there is corpse rods. So there is a terminology that is the corpse rods. So corpse rods, they are isolated keratinocytes. They are isolated keratinocytes, and they have a round shape and acidophilic cytoplasm. They are round shape and acidophilic cytoplasm, and the corpse grains are seen as small So the corpse grains, they are seen as a small hyaline acidophilic ovoid bodies. So they are ovoid bodies and they are similar to that of the pomegranate seeds. So they are the isolated keratinocytes, that is, they are round shaped and acidophilic cytoplasm. They are small, they are seen as small hyaline acidophilic, seen as small hyaline acidophilic ovoid bodies, that is resembling the pomegranate seeds. Then we move on to the cutaneous tumors. So cutaneous tumors, there are two. There is squamous cell carcinoma, SCC. So under the squamous cell carcinoma, there are atypical squamous cells. So there is atypical squamous cells. Next, looking at the BCC. The BCC stands for the basal cell carcinoma. It contains a cluster of baseloid cells. So B for basal cell carcinoma and B for the baseloid cells. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.